Good morning, good afternoon, good evening to everyone joining us from different parts of the world. We are in a difficult situation right now, and the goal for the session today is to get experts who have been working on Ukraine relief over the last few weeks to get their thoughts and perspectives on how potentially companies, individuals, employees can help people affected in different ways and form inside Ukraine and outside, so that we could collaborate together, build a common platform which helps to channelize the efforts in a much more effective manner. So I'm Abhishek, founder and CEO at Goodera. We have an esteemed set of panelists today, starting with Gabriela, who is the founder of nonprofit TAR, which in English means I Hear Romania. She's based out of Romania and has been working in this space for some time. Welcome, Gabriela. I'll just introduce all the panelists and then give you a minute to quickly introduce your organizations before getting into your work. We also have Teresa joining us from Project Hope. Teresa is based in DC, and the organization has been doing a lot of work in this space. And we also have Peter joining us. Peter is from Health Right International, but also is a professor at NYU. So welcome, Peter. I'll just give maybe 30 seconds to each panelist to just quickly introduce themselves before getting into details of the webinar. Over to you, Gabriela, for a quick introduction in 30 seconds.
Hello, everybody. First of all, thank you very much for the invite. TAR is a charity that we founded back in 2014 with the main scope of providing non-formal educational programs for children, mainly orphans or disadvantaged. And ever since the crisis has emerged, we have actually turned into a refugee charity, to be honest, providing support on the ground. And I think what's really important that I would like people to know is we are based in a town 70 kilometers near the border. So we're really focused on the ground support. Thank you.
Thanks, Gabriela. Over to you, Teresa.
Thank you for having me. I'm Teresa Pike Rhodes, and I'm the AVP with Project Hope. And our mission is global health and humanitarian response, and we're committed to transforming lives and uplifting communities by empowering healthcare workers to be able to implement and teach innovative life-saving solutions in times of need. In disasters such as Ukraine, we're there providing direct healthcare services, equipping clinics, hospitals, and training local healthcare workers, and making sure that everybody has access to the health services that they need. Thank you.
Great. Thanks, Teresa. And over to you, Peter.
Thanks very much, and thanks for inviting me to join you today. Health Right International was founded in 1990 by Dr. Jonathan Mann, who's very well known in the global health space. We're a global health organization. We principally work in the global health and development space, although we do work obviously now in a humanitarian emergency. We've worked in Ukraine since 2005, and we concentrate on sort of 4 principal areas of global health: reproductive, maternal, child health, HIV, communities affected by violence, which obviously this is the case in Ukraine, and then mental health. Our work in Ukraine, we have about 119 staff, all Ukrainian. We don't employ expats within the organization. And so all of our staff are there. And since 2015, we've been running a project that's been building networks for survivors of violence. These are networks that provide mental health and psychosocial services across 10 oblasts that provide emergency services, including counseling, and then refer them to network partners for food, shelter, housing, medical, other types of needs. Thank you.
Good. Thanks, Peter. And just for context for everyone joining the webinar today, we have experts or people working and organizations working on the ground today, as a panelist, and people joining in the webinar are CSR leaders from companies across the world. The objective for us today is to share as much information as possible, so that as the companies prepare to take action, a lot of them are already in the process of doing it. They have all the right information, resources to take the right action, be it in terms of company action, employee action, in terms of volunteering and donations. The goal is to provide all the information so that there is no replication or duplication of efforts. There's no reinvention of the wheel, but a common platform so that we can share as much as possible to the largest audience as possible. So thank you to all the panelists for taking out the time during such a difficult time for you. And I know it's extremely hectic at your end, so really grateful for taking out the time for this webinar. I will go over to you, Gabriela, and just in terms of a quick note, I'm not an expert and this is an extremely sensitive topic. So in case some of the questions or some of my comments go beyond the realm of what is right or wrong, please do let us know. But just want to facilitate the right conversation here for maximum information and output for people joining the webinar from all across the globe, in more than, I think, 20 different countries in terms of the registrations. So over to you, Gabriela. You are extremely close to the ground, both even literally on the ground. So just want to understand what is the exact situation on the ground? What are the key challenges that you're seeing on the ground? And how is your organization helping on a day-to-day basis on the ground as on today?
Well, the situation on the ground is what it is, meaning we currently have almost 700 refugees crossing the border near us. 80% of the refugees that are crossing the border are in transit, either because they have relatives, friends, or families that provide them with solutions for the medium to long term in the West, and they'd like to be close to relatives they know. Generally speaking, as a personal comment, I would like to say that for me personally, it never felt harder to be a grassroots organization. This is something that I always took pride in up so far, because I think that the biggest social impact that you can deliver is basically at grassroots. But honestly, I've never seen so much despair, fear, and uncertainty at the same time in my entire life. What we have been doing is more or less everything, to be honest. So we are part of the national coordination group. At country level, we have a national coordination group where all NGOs that are involved with providing emergency help to refugees are coordinating amongst each other for all across the borders, across the country, and with local authorities in order to make sure that our impact and the help is provided in an instant and maximized. Aside from that, we deal with individual cases because all of these people that are crossing the border, they need immediate support, and everyone has a different story, from providing them with support to cross their pets over the border and provide documentation for their pets, to providing housing accommodation, whether it's medium to long term. We are now in the process of creating kits, and we have focused on 3 types of kits: transit kits for people that are in Romania for either 1 or 2 nights and then are moving on further; baby kits, because the majority of the refugees that are coming in are mothers with children. And we also developed the children's kit because the children that are coming in, they have no activities. At the same time, we have taken under our wing between 10 and 15 refugee centers where we supply them with their daily needs, whatever they may be. What's important for everybody to understand is that the situation on the ground is in a constant dynamic. you don't really know how the days are going to develop, and the needs are changing constantly. But across the centers that we support and we're in close contact, we provide them with whatever they request of us, whether it be medication or personal hygiene products. Another important point to be made is the accommodation is coordinated by the authorities, but the majority of these accommodations that are hosting refugees are private businesses, guest houses, small hotels, big hotels, even individual people that have had a spare house that have put up their locations for free in order to accommodate the refugees. So I kind of have a sense that it is our duty as NGOs involved in this to provide them with daily support. The situation on the ground is very tense. However, everybody's doing an amazing job in providing spot-on support. At the back end of last week, we have also tried to pilot a couple of integration activities for children. Locally to us in our town, for example, we've got about 50 refugees with children that have mentioned that they have no other place to go, so they're not necessarily in transit, but will stay here for an unlimited period of time. And we have tried to integrate them into some educational activities. And our impression following that is that it is still very early. Everybody's still very scared, so it might need a bit of time to process. In the meanwhile, what we have done is we have managed to partner with a UK-based organization, and we've got over 500 school bags that are on our way to Romania, so we can provide that with within the medium to long term for the children that will actually stay in the area and integrate within kindergarten schools and so on. And I think I've been speaking quite a lot, and mainly we do everything. We're not necessarily focusing on a particular subject, because what's valid now might not be valid in half an hour. And everything is in a very fast moving environment and in a constant dynamic.
No, thank you, Gabriela, for sharing this with us, and just thank you for all your efforts. I think it's the situation is evolving at a very fast pace, and whatever is needed at that point of time, you're trying to help both on the ground as well as refugees from a more mid to long term basis as well. So thank you so much, and we'll come back to you on potentially how companies can help. But thanks for sharing it. Over to you, Teresa. Right now, just the same question. What's the situation on the ground from a Project Hope perspective? What are you doing on the ground? How is it impacting people on the ground? Would be great to get your thoughts on it.
Yeah, just as an FYI, Project Hope was in Ukraine since 2008, providing HIV, TB, health support. So right now with this current crisis, we're in 4 countries: Ukraine, Moldova, Poland, and Romania. And let me tell you, before I talk about what we're doing in Ukraine, update you on our activities in the other 3 countries. So in Moldova, we're procuring items and key medical supplies and providing support to the Ministry of Health who's supporting refugees. So the kits that we're mobilizing and transporting are IEHK kits, hygiene kits, and non-food items, blankets and those kinds of things. In Poland, we just had a shipment of medical supplies to a neonatal hospital in Kyiv. That happened, I think, on Friday. We're also establishing warehouse space and sustainable logistics corridor. So that will happen in Poland. In Romania, we are working with in the areas of mental health, sexual gender-based violence, support for refugees, and this is through local partners. And then as it moves to the Ukraine, we just got a shipment into Lviv to a hospital there with medical items and support. So that just happened, and I haven't seen any emails crossed for any more information. But we do have a medical professional in Dnipro who is assessing as much as he can on the ground as the situation, and then helping us identify where we can support. So the first shipment was to the to a hospital in Kyiv. We also compiled trauma kits that were delivered in Odessa. And so the idea, as soon as the humanitarian corridor opens and identifications are communicated to us, and we are accessing supplies and items and then transporting them in and supporting health systems right now. When we get more into where it's safer, I'm sure there will need to be healthcare surge support, and Project Hope will be a part of that, where it is appropriate and safe to move in volunteers, health professional volunteers, or where they're needed. Moving forward, a huge piece of what we're seeing on the ground is going to be additional support with gender-based violence, trauma, mental health, those kinds of issues. And so Project Hope is gearing up in those areas, working with health professionals and identification and the tools that they need to help refugees and people in the country. So I will stop there.
Thanks, Teresa, and great to learn about the holistic approach towards this crisis. And thanks for sharing this information. Very, very helpful. Over to you, Peter. Would love to understand, from an on-ground perspective, you mentioned there is a fair amount of your team based there, and would be good to understand how you are helping on the ground and what's the exact situation.
Yeah. So as I said, we have 119 Ukrainian staff. They are spread out around the country. And we've got a number of staff who are currently stuck in the East, who can't unfortunately get out. They're waiting for humanitarian corridors to open up. But we are continuing to work internally. And there's a lot of, and particularly in the West, where there's there are many internally displaced Ukrainians who have moved from the East and from Kyiv West into places like Lviv. Lviv is quite quickly becoming overcrowded, as it's sort of the kind of door to the West into Europe. And so we have, I mentioned these support networks that we've built. As I mentioned, we started this project in 2015, and we built these networks in 10 different oblasts. These networks are anchored by mobile teams that are comprised either by 2 social workers and a psychological counselor, or 2 counselors and a social worker. And those mobile teams move around the oblasts. They're linked to folks both via internet. We've got a website and a hotline that we run nationally for folks who are survivors of violence and who need assistance. We're currently, and as I say, those mobile teams act as a service and a referral node, and the clients are then referred to a variety of services that we've built, a network of services that we've built in each of these places: medical, shelter, mental health, food, clothing, and economic support as well. We're currently, we were running 52 of these mobile teams across 10 oblasts at one stage. The project was also designed to be run by local government. We've handed over 2/3 of those mobile teams to local governments. And so we're still running 13 of them. And we now have plans we've been in discussions to stand up 50 of them, so an additional 37. to get to meet what is going to be a surge in need for mental health and other psychosocial services. And so that's really our focus at the moment, standing those services back up and bringing the services to where folks are. Linked to these, part of these networks too are local community-based organizations and local NGOs who also need resources, and we act as a channel to resources for those organizations. I think one of the things that we're prioritizing in this crisis, which you don't always see, is number one, and I think this was mentioned, focusing on reviving or rebuilding existing infrastructure and networks. These resources are there, and they just need, we'll need a little bit of investment to revive and rebuild, not to reinvent. I think that's an important priority as we think about how to help. And getting money and resources into the hands of Ukrainians themselves is also a really, really important priority. They're best positioned to deliver these services, and hopefully soon, one hopes, begin the rebuilding process, though of course who knows what happens. So I think that's what we're thinking about, and that's what we're focused on at the moment.
Thanks, Peter. And you mentioned about potentially increasing the number of mobile teams that you have, and different kinds of support, as well as more mid to long term as well. Would love to understand from you as to how companies, potentially corporates, can partner with you in terms of both at the organization level, at an employee level. I think it would be good to understand that if there are any specific potential needs and ways in which companies can partner, and how that would potentially help solve things, or not solve, but at least help contribute to limiting the pain as much as possible.
Yeah, I think there are, most of the ways at this point, frankly, are financial, and we're just focused on getting our Ukrainian staff these resources. And I'll give you a couple of examples of things that we're looking to resource as part of these networks. And maybe some of your corporate partners might have some resources here. So one is legal services. Obviously, for anybody who has relationships with lawyers or legal service providers in country, that's a need at the moment. And one of the services that we're also looking to link as part of these survivor of conflict networks that we're building out the legal piece as well. The second is the second thing that we're really looking to do is add a medical professional to these mobile teams. The mobile teams have principally been mental health and psychosocial focused in the past. There's a growing need for emergency medical services to include a nurse or a doctor with these mobile teams. And so we're looking for support to do that as well. So principally, right now, the support is financial, and our priorities are, again, standing up these mobile teams to meet folks' needs on the ground. Also to where possible, to purchase basic goods, food, clothing, stuff like that for folks who need it. I think those are the two just a few examples of the things that we're looking for at the moment.
Got it. Thanks, Peter, for sharing that. Over to you, Teresa, in terms of how potentially companies can partner at an organizational level, at an individual employee level, both in terms of from a company stand, donations, volunteering perspective. Would be great to understand that. Just before you start responding, I just wanted to remind all the people joining the webinar that you could just go to the Q&A tab and put questions for our panelists. I think just would be helpful to share your thoughts, any questions that you might have. At the same time, I also feel all the three panelists, there is some way of collaborating as well, as in just as we hear the work that you do, I think there is potentially some ways to collaborate as well. So just wanted to mention that before going over to you, Teresa. Sorry, but just wanted to make sure that everyone can participate and ask questions that they would potentially want to.
I will echo what Peter said, is that right now the primary need is cash to be able to procure items and transport them and get the staff to be able to move them. That's our number one priority. And, if again, it's hygiene kits, it's medical supplies, it's medicines. We're working with pharmaceuticals on specific things such as insulin, There's also a need for an epilepsy medicine. So we're identifying the needs and then trying to get the procurement of drugs into Ukraine as much as we can. And then also supporting at the border where needed. So the immediate need is the financial resources. The second need is also too, that how companies can help is the social. We always have the fear that there's a reaction to the emergency, but there's going to be, as we move forward, there's going to be recovery. This isn't going to end in 2 weeks and then we're all going to go home and feel good about it. This is going to be long lasting. We need to keep it alive and in front of people, the importance of it. So social media, people going on, continuing to keep the conversation in front of what the needs are, which are going to be ever evolving. Right now, with Project Hope, it's supporting refugees, it's supporting people on the ground with the medical needs. As I mentioned, then we'll move into mental health and psychosocial and gender-based violence issues and so forth. After that, I don't know what the need will be. And I'm guessing it's going to be, how do we support them to rebuild and do it locally. Then the third piece for Project Hope is when we are able, that surge support. So hospitals and clinics that have been decimated, or people not coming back in, the medical professionals who are not immediately coming back to Ukraine, could there be a weakness in the system? So we will need a surge of volunteer medical professionals. So that if there are individuals social workers, physicians, nurses, things that Peter mentioned as part of of their work, those are the kinds of things that we'll be moving into hospital situations to support them. So I think it's a long process, and right now it's supporting it with the cash to all organizations who are supporting it. We do health, and it's also companies looking at food sources and clothing sources and those kinds of things.
Can I make a one thing that we've seen, one of our board members, this particular board member's company decided that they were going to help out by providing a match to any employee, a financial match up to $50,000 to any employee who donated. And this company, between the match and the fundraise, raised $100,000 in 24 hours just from their employees. It's obviously a large company, but just as an idea of things, to the ways in which companies can sort of support their employees to help and incentivize that. That was one thing that we saw that was really, really helpful. And that's cash, as everybody on this panel has said, that can be put to good use immediately. I also want to echo something that Teresa said that's really, really important. And this is actually where HealthRight has historically focused, is on recovery and rebuilding efforts as opposed to relief efforts. The relief efforts in the moment of crisis, understandably, get a lot of attention. This is going to be a long process. So I've been on a number of these panels, and one of the things that I always sort of, my plea is for people to sort of stay engaged. We need people who are sort of engaged now, but who are also patient and persistent, because the needs, as Teresa said, they're acute now, they're going to persist, and they're going to change, they're going to evolve over time. And we want to be able to respond from emergency relief to systems rebuilding. It's one of the reasons that these networks that we're busy building, that we've been building for the last 6 years, reviving those is really important, because these are things that will endure long beyond the sort of emergency. And it's also great that we have 3 people here who are sort of working in slightly different phases of the response, with refugees, where there's obviously an acute need, and then also in emergency medical services and building up that infrastructure, and then broader mental health and psychosocial services. I mean, the need for all of this is just going to be is massive now, and is going to continue to evolve. So that sort of commitment over the long term is going to be really, really important. And so, like, thinking about this not as a momentary thing maybe, but as like, from a corporate perspective, how can we provide ongoing support? Maybe reframing it slightly.
Got it. No, that's like a really valid point. I think given that currently it's top of mind for everyone. So there is an outpouring of, emotions and support in all directions. But I think relief is step one. There is, the rehabilitation, then recovery and rebuilding, which needs to be done over the, next couple of years, in fact. So, and there is support needed, and potentially in many cases, this doesn't remain top of mind for people, and then the support becomes a constraint. So just understand that, and want to make sure that we echo that comment across to all companies joining in. Also, the other point you mentioned about employee matching, I think we have seen that across companies where companies match employee donations. A lot of companies also have something called as a dollars for doers, where for every hour volunteered by an employee, the company donates money to that nonprofit. So that's like a dollars for doers program. There are different ways in which companies are trying to create sensitization awareness amongst their employees, so that potentially they get involved over the mid to long term. As well as one way to potentially have longer term commitments is to have employees from a company engaged over the longer term to this cause, and being passionate about solving for this, not just today when it's top of mind, but being continuously involved and engaged, because that's when it becomes actually a problem solving exercise rather than a pure relief, which obviously is the need of our now, but understand the mid to long term needs. And over to you, Gabriella. Just would love to understand from a corporate perspective, given that there are a lot of companies joining in, what can they potentially do from a company level, employee level, both in terms of donations and potentially volunteering over the mid to long term. So would love to get your thoughts.
Yeah, sure. I totally agree with Peter that we need to focus our efforts not just on the immediate, but both in the medium to long term. What we have seen from the ground, especially in the first week, was a lot of people donating chaotically without checking necessarily what's going on. And I would always advise everyone always coordinating the need with the resources with the need, in order to make sure not to waste any resources, because we will need them in the medium to long term. So within this current scenario, needless to say that obviously the most important resource at the moment is the financial aid, and at the same time the products requirement that are correlated with the need. And I don't know, to give a concrete example, if we're doing baby kits, we need nappies or baby wet wipes in this perspective. However, as mentioned in another European panel I was last week, I would like to also draw the attention to something I'm seeing on the ground. We need to also take care and encourage the volunteers that are working at the border, and not just at the border, but the ones that are hosting refugees and are doing stuff for the refugees 24 hours a day, because it is increasingly emotional for everyone. And I think to a certain extent, volunteers also need, maybe, I don't know, messages to be encouraged to stay strong, because we also need volunteer resources within medium to long term. We need them to keep a clear mind, stay focused, and not let themselves affected, even though I know it's very hard, because I've been meeting refugees and it's not necessarily easy. But we need to try and snap out of it, because if we don't keep a clear mind, then we won't be able to provide not only the short-term support, but the medium to long-term support that Peter's saying at the moment. So I guess, aside from everything that has been said, what I was trying to sort of stress out is maybe there's a potential to create a campaign where we encourage every volunteer that is involved in this, that we actually appreciate their work, and they need to keep on doing it, and then they need to also take some rest when they feel to take some rest, so that we can coordinate within the medium to long term. And also, what I think it's very important at the moment, and as you mentioned earlier, I see it happening, is that we as organizations doing different bits and bobs, it's important for us to learn how to cooperate at our best in order to be able to deliver and not, duplicate our efforts and so on.
Got it. Thanks, Gabriela, for mentioning all the different ways in which potentially companies can help. Definitely, the kits is something which is a common theme that we could understand, and I think a lot of companies are still trying to figure out the logistics of it as to how it would potentially work. Do you ship it from the US or different parts of the world? And logistics, supply chain is an extremely a tricky topic right now, given all what is happening. So any thoughts or on how exactly this would work? So let's say there is someone who is a CSR leader, wants to support certain kids. How will it work? And that's an open question to any of you, but Gabriela, if you want to take it, or anyone, on how exactly this would work, the process, the timelines, I think that would be super helpful for people to understand. And also, I'll come back to the second point you mentioned around the campaign to support volunteers, but just wanted to first understand this part from everyone, because this is a common request, but I think sometimes the nitty-gritties just take so much time that by that time the situation has changed completely. So just want to understand that. Yeah.
In terms of the kits and the necessary items, logistically speaking, we have been, for example, receiving money to do that, but we have also been receiving items for particular products that we can put in the kits. Logistically speaking, it's easiest if they're shipped from a headquarters in Europe towards Europe. And this is what has been going on so far. However, on a different side, because I was mentioning the UK earlier, that we received the school bags, it takes a bit longer for them to arrive, but it's important for any company that's seeking to ship to a charity in Romania, that the charity in Romania has already a tax exemption on imports outside the US. It's not necessarily, honestly speaking, it's not necessarily that complicated, as long as the charity receiving knows the exact documents that need to be done and the paperwork, and they have all the necessary documents in order not to pay taxes, because then if you have to pay import taxes because of imports outside of the EU, then there's no, it's just not practical. But even though it is not necessarily something that it can happen in a day, but it is doable from this perspective. So what we are seeking to address, for example, personally with the kids, is the way we distribute them in terms of how we do our logistics. We distribute them to refugee centers where we know new people are coming in. But what we also do, we have a partnership with the social protection services at county level, and we distribute through their hub at the border in order to make sure that the kits reach as many refugees as possible.
So thanks. And Teresa, Peter, if there's anything to add, please to add in. What we'll do is, as a follow-up to this webinar, is also create a doc with how this what's needed, how will it work, so that it's simple for everyone. But any thoughts currently, please to share.
I'll just add that it's really important, which Project Hope takes as a priority, is collaboration on the ground and making sure that we're not duplicating services, but that we're providing services that are needed. And Project Hope is a member, as I'm sure others are, UN collaboration, such as the WHO Health Cluster Groups, UNHCR. We're also working with embassies. We're also working with ministries of health. And so I think it's really important for others to understand that organizations such as ours just don't show up and then say, we're going to do this. We have an understanding of the region, and we're collaborating with those who can then further access it on the ground and make sure that things happen. So it's in collaboration, and I think that's very important. The other thing that I just want to highlight as it speaks to the future is another area that is of concern, though I haven't heard much about it, is child trafficking. There are situations where there are tons of really well-meaning people who are going to the borders and offering and picking people up, mainly women and children, and providing homes and so forth. 99% of them are on the up and up, and it's a positive, good heart thing. But there could be situations that people could take advantage of people crossing the border and being in the line of being a volunteer to provide support, that it could not be in the best interest of those that they're picking up. So we're keeping an eye on that and monitoring the situation and providing support if we can.
Good, and that's thanks for bringing that up. I think there are some very unintended, really bad consequences potentially which can happen. So thanks for sharing that.
Yeah, I think I want to echo a couple of things. One, so on issues like logistics, I mean, there are organizations that are very good at logistics, and if you're work for or run a company out there that has particular expertise in logistics, those you might be able to be of service if you get in touch with particularly some of the larger NGOs that are coordinating humanitarian relief. We don't, I'll give you an example. Speaking of division of labor here, like logistics is not our thing. We don't do logistics. We link up with other organizations that do, and we're able through our, particularly through our mobile teams and through these networks that we've been building, distribute goods through those. So we link up in country with other organizations that are providing those goods. So we're not on the sort of logistics or organizational end. So I want to say two other things. One is somebody said there's a question in the chat about international shipping is a challenge, and it certainly is. And again, I know it sounds a bit crude, but really financial resources are what's needed. Money is really truly one of the best ways to sort of support what's going on. The other thing I want to pick up on is something that Gabriella said that I think is really important. Number one, supporting volunteers, but I think going beyond that, and this is something that I didn't mention that is really front of mind for us, and that is providing support to the healthcare providers and the mental health providers themselves. So this notion of caring for the carers is really critically important, particularly when you're talking about, what looks like it's going to be a long-term effort. And so that's something else that we're really thinking about and devoting resources to, making sure that the folks, our staff and other NGO and community-based organization staff who are providing these services under incredible duress, under very, very difficult circumstances, they also need support. And so creating supervisory networks where they have resources themselves to go to so that they can get the care and support that they need so that they can continue providing those services to the people that need them. So I just wanted to also mention that. Gabriella mentioned it, and I wanted to echo that. I think it's a really, really important feature of both relief and recovery efforts.
Got it. No, thanks, Peter, for sharing that. I think the caring for the carers is like something which also Gabriella mentioned. I think was really powerful, and I think probably just as one key output of the webinar today is something potentially we could launch this campaign of caring for the carers, which is about providing different sorts of support to the volunteers themselves. I think a lot of people want to contribute, but they, for different reasons, can't be on the ground, and but they could potentially provide the financial support. I think that is something which is hugely important, and that is the fastest way to help in some way. But the second is in ways in which volunteers can help volunteers. I think that would be something that we as Goodera would be also well positioned to take it up, and would love to take that up together with some of the companies that we work with, and all of you, if you feel that this is something which potentially can be helpful. I think this is something where we definitely can add a lot of value. And I think once people get engaged, there are it's long-term engagement. It's driving their companies to also help in financial support and driving their colleagues and team members and their communities to drive financial support. So it becomes like a good stakeholder to have, and I think this is a great way to engage those stakeholders. So thanks for sharing that, Gabriela and Peter, and would love to, as an output of this webinar, actually take up the caring for the carers as a key campaign and a theme that would want to pursue across.
Because some of that can be,
yeah.
Some of that can be provided remotely too. So that's, we live in an era where some of, that's possible. So yeah, so I think there's an opportunity for creative problem solving around how best to provide that kind of support. In country, obviously, that's what we're thinking about, but you could imagine
Sure.
Other mechanisms for providing some of that support. So yeah, that's great.
Great. There are a couple of questions which have come up in the Q&A. I think one aspect is definitely sharing the continuously evolving needs. So let's say today there is something needed, 2 weeks from now there's something needed. So what we'd like to do is share with companies as to what is the current need. So is there a way to keep up with the rapidly evolving needs? Do you have some updates, newsletters that you have? What we as Goodera could do is consolidate all of that and share it with the company. So if there is something like that, I think that would be super helpful, because the need is continuously changing, and the worst thing to do is to solve the wrong problem today. So I think that would be super helpful. If there are any updates, we can help consolidate that and share it with companies. Second is, if there are, I think there's a question on administrative tasks, and there are certain things that can be done from somewhere else so that you have all the time and energies to focus on the core issues on the ground. So I think that again is a really interesting comment that came in. There are again certain things around documentations that translation from Ukrainian to English and vice versa. So if there is any help or work needed on that side, I think that was another question. But I think just consistent patterns of questions. One is the kit based and how that works. Financial is the best. If there is some shipping to be done, what are the different best partners? So that is a resource kit that we can provide across. Second is the caring for the carers. Let's start this right away. I think there's no better time to start. The third thing is there are certain administrative tasks at which potentially can be done to help help people on the ground just focus all their energies and attention to the core work that they are doing. So I think these are some of the outputs that we are taking as part of the webinar. I think on the financial help also might be good to understand how to do it, and I think from our side at Goodera, ensuring that from a taxation and compliance and legal checklists, it's all sorted. But I think if as a follow-up to the webinar, we could share a small note on what each of your organizations are doing and how financially the help can potentially be used. For example, Peter, you mentioned about the $100,000. Now how is it getting used? And then some case studies would be helpful so that we can share it across with everyone. And I think the mid to long term aspects, how to keep people engaged so that it's not a one-off, top of mind thing, but happens across the year. And there is a point on a lot of unintended consequences, and there might be so much that we don't know what we don't know on what are the issues that might come up. So just keeping up with it. I think we have about 10 minutes left. I would just want any final comments from each of the panelists on this topic and how best to keep engaged. We don't want the webinar to be just a one-off thing, but how do we keep engaged? So probably I'll start with you, Gabriela, on any final comments from your side. And if there are any other questions, please keep sharing them. But just one final round of comments, and then we'll go through all the resources that we'll share post this call as well. But Gabriela, over to you.
First of all, thank you everyone for being here and for listening to us. And I would like to congratulate my colleagues panelists for their amazing work. As Peter was saying in the beginning, I think it's great that each of us is involved in a slightly different perspective of this. Also, thank you very much for the feedback received from Q&A. And I do agree, yes, that this webinar should actually be the first step into moving further and potentially doing something. And as we were discussing and talking, another thing that crossed my mind, I know a lot of people want to help, and I know a lot of people are not necessarily next to us on the ground or feel like that they can't do, but I believe they can do a lot by promoting the project, by talking to other people about it, and also why not maybe joining into this campaign that it looks like we've all agreed it's a massively important one, like caring for the carers, maybe with small messages of appreciation towards the volunteers and everybody that's doing frontline work on the ground. So honestly, my intake is, I believe that we are in this, as we've all agreed in the beginning, for the long term. And I think every person that wants to help will get their chance to help in a way or another. We just need to be smart in how we use our resources to make sure we can all take this into the long term. Thank you.
Great. Thanks, Gabriela. Thanks for your words. Teresa, your final words from your side.
You know, I think we've shared, and what I would say is that I'd be happy on behalf of Project Hope to share with Goodera our situation reports that you can push out. Anybody can always contact me. I'm fine sharing my email address if you want it, if you want in the know, or if you have specific interest. One thing I did mention is that Project Hope does have a logistics team, and we do move commodities, and we do accept gifts in kind. The one thing I would say is that we're not accepting, you know, we get lots of calls from, you know, communities saying, you know, the neighborhood put together 100 masks or something. We're talking massive tons of stuff and movement, and that would be our preference to have an impact. But yeah, just as we said, keep this in front of you. It's not going to end. Right now, it's the heightened crisis, and eventually our media is going to get tired of it and move on to something else. But we have to keep it in front of us, because there's going to be people in need, and we're going to have to support them in rebuilding their systems.
Great. Thanks, Teresa, for sharing that. And I think point noted on the logistics piece on the kits, and I think that is something that we'll also follow up with all participants, as well as I think the common theme across is that this is not, you know, top of mind media related issue. It's a much longer term issue. So thanks for sharing that. Peter, final comments from your side.
Sure, thanks. I think to the audience, first of all, I would echo what Teresa said. I'm personally happy for you to share my contact information. I'm very happy to have a conversation with anybody who's interested in learning more about, you know, what we're doing on the ground and how they can be helpful. I think it's important to remind folks to think about this as this is multiple crises sort of all wrapped in sort of a, you know, you've got, as we mentioned, you know, thinking about the different areas of needs, you've got refugees and they've got specific set of needs, which Gabrielle and her team and others like her are focused on. You've got folks who are IDPs, internally displaced people, tons of, you know, we've heard about the millions of people who are refugees. There are more people internally within Ukraine who are displaced. Those folks have you know, enormous needs as well, slightly different needs, including obviously the geography being different, being in country, and then you've got folks who have remained where they are, who are going to have needs as well. So I think thinking about these as sort of slightly different buckets and thinking about where everybody, you know, we need to sort of apportion our support in different ways and target it. And so thinking about, where you think you can make a difference or where you want to make a difference is important. And understanding, who's doing what on the ground. And again, I make a plea to think about ways in which to get resources into Ukraine as well. I mean, obviously there's massive need for refugees, but we, thinking about that and getting resources into the hands of Ukrainians I'd also echo the notion that, following us on social media, we're very active on social media and getting messages out. We have a statement coming out actually on caring for carers with our partners at Johns Hopkins University and IMC. We have another statement that we're leading with several dozen local Ukrainian NGOs about the need for mental health and psychosocial services that's coming out, amplifying those voices and those calls that will help sort of focus minds and attention and resources on needs that are being articulated by people on the ground, I think is really, really important. And following us on social media is a great way to do that. So I would just echo those few or mention those few things as we sign off, and just thanks for everybody for joining and taking the time to learn more about what's going on and how you can help.
Yeah, thanks, Peter. And I think one thing which has come in some messages to me directly is that a lot of people want to just spread the word, I think, and that's obviously just in their way help in some small way. So I think any suggestions on that would also be super helpful. But the three categories you mentioned were also, the kind of people who need support, and the kind of support will also be very different based on which three buckets that they fall into. So thanks for sharing that. I think there's some question, a question from Rose, which she had raised her hand. In case you want to ask, we'll try and unmute you, but if possible, you could just put in the question in the Q&A. And we could potentially answer. I think just in terms of follow-ups from our side, we'll share updates from all organizations periodically. Second is if all of you are fine, we could share your email addresses with everyone so that they can connect anytime as needed. Third is we would love to launch a Caring for the Carers campaign, and I think Peter would connect with you if there's something already happening, don't want to replicate it, but I think that is something which I think a lot of people can start contributing to in small ways, and then get involved in this exercise, and then keep engaged for the mid to long term. And then any resources around kits and how it works, logistics, what's the best way financially to solve and help and contribute, we'll share that across with all companies as well. So yeah, that's it from our side. Thank you everyone for joining us. If you have any further questions, please reach out to us, and we'll follow up with the panelists so that you get the right information. And as said, we are not experts, we're just trying to facilitate. And thank you to our esteemed panelists for taking out the time at this moment, and look forward to all of us working together collaboratively in trying to solve in small ways in whatever way that we can. Thank you so much, everyone. Thank you so much for your time.
Thank you.
Appreciate
Thanks
it.
a lot.
Thank you.